With the queue for public housing getting ever longer, there are growing calls to increase supply of transitional homes. A welfare group has suggested converting a COVID quarantine center into transitional units, Macy Mock reports.
Built earlier this year, the Kai Tak Community Isolation Facility currently houses COVID patients with no or mild symptoms. While it's meant to be temporary, the modular units are fitted with all the necessary equipment, including lifts. Now an NGO is eyeing a potential conversion into transitional homes for the needy when the facility is eventually decommissioned.
With this provision, I would expect more grassroots people, those living in subdivided units. They could move into this kind of transitional housing earlier.
The Kai Tak facility could provide 2,700 units, 10 times the size of transitional housing projects undertaken by the Hong Kong Council of Social Service, which Chua heads. He estimated the conversion works to take 3 months, after which the units can operate for 5 years. Around 5,000 transitional homes are currently on offer, just a quarter of the government's target. Chua said demand still far outstrips supply, as over 240,000 applicants are currently waiting to be allocated a public flat. Only 1/4 of tenants from the council's social housing project in Sham Shui Po could get on a public flat. He suggested allowing future tenants to stay longer, but admitted there is no guarantee they will receive a public flat when the lease ends. The Society for Community Organization also called for an increase in transitional housing supply. Deputy Director Si Lai Shan urged authorities to set a goal of 3 years in which applicants can be allocated a public flat compared to the current wait of 6 years. Macy Mock, HKIBC.